Did you know that up to 60% of patients in the ICU and critical care settings have exposure keratopathy, or better known as EK? Similar to the literature, recent spot audits of ICU patients at both Royal Alexandra and University of Alberta hospitals revealed that approximately 51% of patients had varying degrees of EK. Exposure keratopathy occurs when the cornea has a disruption of the tear film or is inadequately protected by the eyelids, which can lead to ocular surface dryness, damage, and even acute and permanent vision loss. There are certain risk factors specific to the ICU and critical care settings that can contribute to a higher risk of patients developing EK, such as mechanical ventilation, chemosis or swelling of the conjunctiva, incomplete eyelid closure or lag ophthalmos, patients under sedation or with lower levels of consciousness, and prolonged stays in the ICU. The clinical manifestations of exposure keratopathy can range from mild discomfort, red eyes, and tearing to more severe outcomes like corneal abrasion, infectious keratitis, corneal perforation, and scarring, all potentially leading to significant vision loss. Recognizing exposure keratopathy early through regular eye assessments is crucial. Look for signs of dryness such as red, injected eyes, an irregular ocular surface such as white opacities on the cornea, and finally, incomplete eyelid closure, or better known as lag ophthalmos. To prevent this potentially vision-threatening condition, we have integrated an ocular protection protocol order set on Connect Care for all patients admitted into the ICU. In this protocol, patients will receive different lubricating eye treatments depending on certain risk factors. If the patient is alert and awake, they will receive lubricating drops 4 times a day. If the patient is sedated or mechanically ventilated, they will receive lubricating ointment 4 times a day. For those with incomplete eyelid closure, they will have their eyelids taped closed to protect their ocular surface. These standing orders have been written such that the MRP or nurses can independently choose which agents are most appropriate for the patient dependent upon their evolving clinical status. This order set will also be available to all other patients if you simply search for the following. To correctly administer a lubricating drop or ointment, or to tape the patient's eyes closed, first perform hand hygiene with soap and water or with an alcohol-based sanitizer. Gloves may be used. For lubricating drops, gently pull down the lower eyelid to expose the conjunctival sac and, if possible, ask the patient to look up to avoid inadvertent trauma to the cornea during drop administration. Then, place a drop into the conjunctival sac, avoiding the tip of the bottle or minimum from touching the eye. Ask the patient to then gently blink, while encouraging them to avoid tightly squeezing their eyes shut immediately after administration, as this may lead to the drop being squeezed out of their eyes. For lubricating ointments, gently open the eyelids to expose the conjunctival sac. Then, place a small ribbon or strip measuring approximately 2 millimeters of ointment into the conjunctival sac, taking care to avoid inadvertently damaging the cornea. Following this, gently lift and lower the upper eyelid to help distribute the ointment across the ocular surface. For patients who have incomplete eyelid closure, apply paper tape to the upper eyelid and gently pull downwards to close the eyelid while placing the other end of the tape onto the patient's cheek. Ensure that the eyelid is fully closed and that the tape is not adherent to the corneal surface. Following each of these tasks, remember to perform hand hygiene. In summary, exposure keratopathy can be a vision-threatening condition that occurs when there is a disruption in the tear film and/or inadequate closure of the eyelids that ultimately leads to corneal damage. By assessing patients regularly and using the ocular protection protocol, we can take steps in reducing the incidence of this otherwise preventable condition. On behalf of the Eye Institute of Alberta, we thank you for your dedication to patient care.